Happy Hump Day. This is Dr. Stanley, your perinatal specialist, talking to you today about perinatal infections. Now, before we kind of check off and roll our eyes, I know we've been through 4 years of infection anxiety. However, perinatal infections, or what we call viral or bacterial infections that can affect either fetus, embryo, fetus, or neonate, is the leading cause of neonatal illnesses and stillbirth. So I just wanted to take a few minutes to just kind of step back and review. It's a broad topic. It seems like for each passing year, there is an identifiable viral or bacterial organism that we are learning things about. Back in the day, it was rubella and German measles. In 2012, 2016, it was Zika. And then we had the coronavirus and the question mark on that. Let's break down infections into infections that can cause malformations and infections that can cause growth problems. Now, the category of infectious agents that can cause malformations, it's a long list, but I'm going to pull out a few. For example, chickenpox. Chickenpox can cause limb defects. Rubella, which we haven't really heard from in a long time because our community vaccination programs a while back were pretty solid. Unfortunately, because of the change of attitudes towards vaccination, there are a lot of diseases that we haven't seen for a while that are kind of making its way around again. So German measles, otherwise known as rubella, can cause a huge amount of congenital malformations. In the first trimester, it can cause eye malformations or heart defects. In the second trimester, it could cause deafness. Syphilis is now also on the rise, and there are malformations associated with that. There are also organisms that can cause problems with growth. Cytomegalovirus can cause fetal growth restriction. Herpes simplex virus type 2 can cause hydrops and nervous system disorders. So, we're not trying to create panic, but I think we kind of have to get back to some kind of pragmatic walking pathway in how we're going to manage infections in general, because there is one unborn fetus that could adversely be affected by it. So there's so many entities. So you think about, how can we get an infection? You can get it through respiration. You can get it through sexual contact. You can get it through the blood. You can get it through handling soil, or certain foods and waters. You can get it if there are insects, and if you're handling exotic animals. So those are all vectors for which infections can pass through. So how do we manage this? We manage this with breathing, and we manage this with a little common sense and not paranoia. Simple things like washing our hands. It is such an important part of decreasing the risk of infections. When I'm teaching my little kids, I tell them, sing happy birthday twice while you're soaping up. Voila, you can then rinse afterwards. Isolation, if you're having a cough or you're not feeling well, you may be febrile. Isolating for the benefit of others, because we don't live in silos, or if, like, this is the season for which the influenza, RSV, and COVID, to name a few, it's just, you think it and you're infected with it. So practically speaking, if you're going into crowded rooms and you know that you're pregnant or you're immunocompromised, you're trying to get pregnant, if you're a teacher, CMV, parvovirus, those things can affect you if you have not been exposed before. So just, kind of picking and choosing when you're going to isolate to reduce your risk of infection. Preconceptional counseling, if you're not sure if you've been exposed to things like parvovirus, chickenpox, rubella. If you have risky behaviors that put you at risk for HIV, syphilis because of unprotected sex, then those are things that you should screen for and then apply the appropriate risk reduction behaviors to prevent ongoing exposure. There are a lot of blood tests that can be done for screening preconceptually. A lot of the prenatal labs do prenatal screening. For example, syphilis. If a mother has had syphilis before, then the RPR or the VDRL titer is really what is important, because there's another test called the fluorescent treponemal antibody, or the FTA. It will always be positive in your lifetime. So that's not useful to us once you've had a prior infection. It's the rising of the antibody titers that we will use to assess the need for treatment. And I particularly emphasize syphilis because I hadn't hardly seen it except for 1 month at one location. I was seeing 4 and 6 cases. So please be mindful. If you have any questions, I know it's a broad topic for a couple of minutes. Please reach out to us at Unity MFM. We can help you figure out where you need to go if you're not close to a brick and mortar office, or we can't offer you telehealth because you're in one of the states that I don't have licenses for. But in all of this, we kind of have to adopt a middle ground to this. Infections are here to stay. There is no way to sterilize our global environment. So just utilizing some precautions would be the best way to deal with this. Hi, Asif. Thank you for stopping by. Doing well, hump day. And we are going to breathe today, and we're going to walk good. I'll talk to you tomorrow. Bye-bye.